Hello, welcome to Meet the Problem Solvers. I am your host, Judy Perlman. I'm very glad to be here tonight with an old friend and colleague, Libby Hayes. Libby Hayes is the Executive Director of Homes for Families, which is a statewide organization that advocates on behalf of homeless families and families experiencing housing instability. This is a field that I came out of. This is where Libby and I knew each other in the trenches working in organizations. So I think we're going to have a very interesting conversation that will range from stories about individuals to stories about policy and major investments. So let me just frame us up today a little bit. We're going to be really thinking very hard about the dollars and cents of living in Massachusetts as a lower income household. Some of the numbers are pretty astounding. After we think about sort of the actual economics, we'll also think about some of the other factors that can lead to housing instability, and they are many. And then we're going to really think about policy and policy efforts that have been made and how well they've worked in trying to address and really end homelessness. So without any further ado, I'm going to introduce Libby, and Libby, put us in the picture.
Thank you, Judy. Thank you for having me. So we're here to talk about family homelessness, and we really look at what's caused homelessness in Massachusetts, and we have to look at the housing and the gap between wages and rent. For starters, when we look at our housing stock, we're short about 170,000 units of housing that's available and affordable to households with extremely low income. That's a statistic from the National Low-Income Housing Coalition, has been backed up by some research by the Fed. So if we just start with simple supply and demand, and understand that that we don't have enough stock, and so the rents go up. And when we look at our wage market and the growth of the low wage sector in Massachusetts, and especially in Boston and surrounding neighborhoods, families that are working low wage jobs or families that are struggling with employment and other barriers are really left out and pushed out.
We were talking about some of the numbers. Put us in the picture of someone who's making minimum wage in Massachusetts or in the greater Boston area, and what life looks like for that person.
Sure. So another report from the National Low-Income Housing Coalition is that a family earning minimum wage trying to rent a two-bedroom apartment in Massachusetts would have to earn $33 an hour. If that's a minimum wage job, you'd have to work over 113 hours, which then also raise your kid and go to school and sleep and eat and all of those other things. So and when we look at the wage market in Massachusetts, in the times since the recession, about 85% of the jobs that we've added in Boston pay less than $38,000 a year, when we know in order to afford a two-bedroom house, you have to be earning a lot more than that. And that's where we really get stuck, is we're increasing the low-wage job market. So we're talking about our customer service, restaurants, hotels, everyone that makes the Commonwealth run. When you look at hospitals, the people stitching up your wounds, doing the billing, everyone that really makes this Commonwealth work is can't afford to live close to transit, close to jobs.
Yeah. So, given that you can't make ends meet, how do so many families actually stay housed?
Well, a lot don't. A lot struggle. We're lucky in Massachusetts that we have some assistance programs that helps. We also see a lot of families that double up, that bounce from couch to couch. And then what we've seen is over the years, as this gap has widened, we've seen our shelter system expand and expand and expand. So now our current numbers, each night in shelter, we're serving about 3,600 families in shelter per night across the state. That is down from a high of 4,800 in peak recession years, but it's also more than double the number of families that we served before the recession. I was looking recently back at old data, and in 2006 we had about 1,200 families in shelter. So now we're serving 3,600. So it's a system that's going to keep growing and growing until we make some change.
So where do you think we should be making those changes, Libby? Where should we be putting our dollars? Where should we be putting our energies?
the number one thing that we see, I think the number one thing that Homes for Families does is we ask first the parents who are experiencing homelessness what they need, and take direction from them. And year after year, when we ask families what their biggest challenge is, it's meeting that gap between wages and rent. And the easiest way to meet that gap is through rental subsidies. We're lucky in Massachusetts that we have the Massachusetts Rental Voucher Program, which is a program similar to the federal Section 8. It was actually the precursor to the federal Section 8 program, and it helps to make that gap. So it helps landlords be able to sustain their part and have some reliable income, and then families pay between 30 and 40%. And we really see a big investment in that. And there's been study after study that back up that housing subsidies is the answer. And what we also see is it needs to be much bigger than that. When we look at fixing our housing crisis, there's lots of things that we need to do. It's the reason why we're here is from years of structural racism. It's from supply and demand. It's economics. And so the solutions have to cover a large swath of things: zoning reform, but if we want to make housing affordable, you need that subsidy. Developers can't develop housing and keep it affordable unless there's that subsidy. So all the solutions need to include that. So we're looking for big investments in that.
We also were talking a little bit before the show about childcare. Tell us a little bit, put us in the picture of childcare in Massachusetts.
Sure. So childcare, that's sort of our number two answer when we talk to families, we do lots of surveys and focus groups and ballot questions and ask families, what is it that you need? Housing subsidies number one, childcare number two. And when you look at the numbers in Massachusetts, we have the third highest housing costs in the state, and we're one of the most expensive states for childcare. And we also look at the childcare sector. We have daycares that are closing down because they can't keep teachers because the salaries are so low. So there's a lot that we need to do in Massachusetts to change our systems of pay, to change our structures to match our values. We have really high values of education in Massachusetts, but we're not paying childcare teachers enough that they can afford a place to live. And we're not supplying adequate or enough childcare for the households that need it. So when we look at the costs, there's a lot that can be contained with the costs. So you have childcare subsidies so that families can afford it. There's sliding scale so they can pay what they can afford, looking at how do we cap that so it's a fair amount, and how do we get teachers a salary that they need so that we can get people into the field.
Wow, that's a lot of moving parts, and it seems like lower income households are coming up short almost everywhere they turn. So that's sort of the economic picture, but put us in the picture about some of the other drivers of homelessness, because I know there are many.
Yeah, I think we touched on a bunch briefly when we look at sort of the long scale systemic issues and our zoning and segregation that we have in Massachusetts, and what that means for housing. If you look at the generator of wealth in our society is housing, and when we excluded certain subpopulations and people of color from being able to accumulate wealth, it's no wonder that people of color, and especially African Americans, are overrepresented in our shelter population. We really see that race is a huge factor, not one that we talk about enough on the policy level and take action enough at undoing some of our policies. I think when you look at redlining and what that caused in the segregated neighborhoods, the lack of access to wealth, the lack of access to opportunities, we need policies to undo that. And then you add on top of that the childcare, on top of that the low-wage job market. And we've seen just a series of tough policy decisions over the years. So as our job market has changed, of sort of a decrease in manufacturing jobs, of middle-income jobs. There's also been a disinvestment in training workforce development programs. They're working to turn that around. But we've changed our job market, but we haven't changed our structures and our supports to get people either in jobs that are paying a living wage or adequate supports in that low-wage workforce.
I remember another very real factor in the lives of many of the families that I used to work with, which was health care, health insurance. I just remember a struggling mom who couldn't get ahead. She worked at Oban-Pan, and one of her children had persistent asthma. And when your child has asthma, guess what? You can't just kind of leave them home with watching TV. And so that's another thing that's going on nationally, but also I think exacerbated in Massachusetts is just the mismatch between health insurance, and also just affordable. It just all snowballs.
It does, and I think what we see is we're not doing enough to support that lower wage workforce, and so the number of families that are getting pushed further and further out. So when you have those situations that we've seen, I mean, you look in the family shelter system, there's children or parents that are terminally ill, there's children and parents with chronic medical conditions that can't work or that need a lot of specialty care, whether it's there's not enough daycare slots for children that are disabled, that have feeding tubes, that are in wheelchairs. It's all of those things that if they're not able to support themselves because of, it takes a lot in some of those situations, they need to go someplace.
Yeah.
And the shelter system really provides that for so many families, but some of the complexities of how do we solve that, how do we pay for it, who should be paying for it, because it's a lot of big complicated issues that families are facing.
And that intersect.
Mm-hmm.
This is Meet the Problem Solvers. I'm your host, Judy Perlman, and my guest tonight is Libby Hayes. She's the Executive Director of Homes for Families, and we are talking about the complexity that is family homelessness in Massachusetts. So we've kind of laid out a lot of the problems. Let's talk about some of the solutions. You started in at it, but let's have another bite at that apple.
So again, I always go back to really making sure that families are engaged in those discussions. And what we've seen a lot in meeting with families and talking to families and having them lead our policy work and discussions is a lot of policies have been set up as a way to manage a crisis and not solve it, or that have unintended consequences. So we see families that are working to increase their income, and they increase their income and get punished on the other side. So some examples of those are families that are, to qualify for shelter, you have to earn less than 115% of the federal poverty level, which is less than $17,000 a year. That's about $1,400 a month. When you two-bedroom apartments, about $2,000 in this area. You're lucky to find one at that rate, and families aren't making even that cost of rent, about half the cost of rent. But if a family that's in shelter gets a job and makes over that, they're put on what's called a 6-month clock, and then they lose their shelter rights. So we're asking people to choose between having employment or having a roof over their child's head. And it really serves as a disincentive. It punishes success. So that's one of the things that, as we've met and talked to families, that they raise as an issue, and something that we're thankfully when the state budget comes out, hopefully in a couple of weeks, because we're behind schedule, that changes both in the House and Senate. And what it does is it doesn't punish families. It raises it to 200% of the federal poverty level to support people to get if they get employment, or able to increase their income in other ways, they're able to save money to be able to move out and get on a pathway. So we see a lot of that, of just job punishment for families that are trying to be successful and really trying to shift that.
So I think that what you're talking about is commonly called the cliff effect. And it doesn't just happen for families who are in shelter, but it happens for a lot of households. Can you just kind of put us in the structural understanding of the cliff effect? That would be really helpful. Sure.
So we see a lot of, especially the cliff effect means that if a family or individual takes one step forward, whether it's with increasing their income or something like that, then they end up having a net loss because they lose other public benefits. And so we see that a lot with, plays out in lots of different ways. So one example is that there is an asset cap. So parents that are on receiving TFDC or in shelter can only save a certain amount of money, and then they're cut off. So some of the families in shelter were actually at one of our events talking to someone from the welfare office and saying, this is so frustrating because we have to save all this money to pay for first, last, and security. We save the money, but then we hit the asset cap, so then we lost all of our benefits. We also see it play out with mass health and childcare. So people increase their income, they get employment, they get a raise, they're moving ahead, and then they have to pay more for childcare, they have to pay more for housing, they have to pay more from health insurance, and they end up having a net loss. And it really is just discouraging and goes against logic when you hear all the societal pressures. Get a job, earn more, and have to get punished for success. So in working a lot, I think what we like to see is having families, shelter providers, advocates all work together, and we've seen a lot of progress from the state in trying to make some of those changes. So One example with the Massachusetts rental voucher program, it used to have an income cap at 50% of the area median income, and they increased it to 80%. And what that does, it just smooths out the cliff so that it's a gradual tapering off, but it tapers off in a way that there's a net gain and gets people on a pathway towards stability, be able to qualify for other things. So we've seen a lot of those type of changes, but those sort of changes help us to manage things better and help make things easier, but we're still not making the big solution and big solve.
So I want to come back to your thought, because you keep talking about sort of managing and that it's not the big solution, but I wanted to stick with the cliff effect for just a minute. What did I want to say? I don't remember, but it had to do with sort of the discouragement that, that this whole entire system is set up to say, you're supposed to be self-sufficient. There's a societal message. There's a message from the social service and housing industries that this is where you should be headed. And then when you get there, it's pretty discouraging.
Yeah, I think when we look at policies, so many policies were made at certain points or reformed in certain points in a way to stop people from cheating the system. And I've worked in the greater shelter system for close to 20 years now. I've never met a family that had, secret condo somewhere and was living luxuriously and wanting to have that stigma of being homeless, wanting to live under people's rules. People don't come to shelter because they don't need to. And I think that's what the switch that needs to happen is, how do we have public policy so they work for people, work with people, and not try to regulate and punish people.
So let's go back and revisit that notion of managing a problem, addressing a problem with a one-time tranche of investment versus something else. Talk us through what you'd really like to see happening here.
What we really need to see is a big approach on all levels, from the state, from cities, municipalities, and from the feds. This is the level of inequality that's in this state, in this country, in this city is huge. And so it really needs, what we've been doing is putting Band-Aids on things. And we have this shelter system has its pluses and minuses, and it's a lot of managing of how do we serve the people that need it most, how do we watch the bottom line, how do we not have it grow so much, how do we help people. But if we really want to make that shift, we need some deep investments and a multi-pronged approach. So one of the things that we saw, I think it was in fiscal year 2015, don't quote me on that one, but we had a $26 million investment in the Massachusetts rental voucher program. What they were able to do with that much of investment is really, one, give a lot of people subsidies so they could move out into their own housing, but also could reconfigure some of the shelter stock to be able to convert some of it, to be able to have more efficiencies. What we've seen is when there's smaller investments made, it just keeps things status quo. And I think that's one of the things that we've been really frustrated by is we know what works, and we know that big investments help, but seeing these smaller investments just keeps things status quo, and 3,700 homeless families in Massachusetts is not acceptable. It's not acceptable to still be serving more than double the number of families since before the recession. That's not okay. And what we've seen a lot is when we're in motels and when the Commonwealth's had to rely on motels to be able to serve everyone, there's a lot of focused energy, there's a lot of commitment. And then when we're not in hotels, it's on to something else. And the problem then just gets worse. So I think we really need to look at large scale, looking at revenues differently. How are we going to pay for this? Looking at different models for investment, looking at different models to get revenue, and making big investments to turn this around.
One of the things that we talked about briefly before the show was also the fact that different levels of government invest funds, which in a way lets the level of government that's not investing funds kind of go along their merry way. So for example, HUD, the federal government, invests a fair amount in homeless housing for persons who are homeless. The state invests a great deal in shelters and other services. Our cities largely don't invest particularly, and so while many more families from a particular community may be experiencing homelessness, it's kind of not felt. Can you say a little bit more about that?
Sure, and I think, and to expand on it too, it's government, it's also our corporations, it's also, so what we see is the family shelter system right now is run by the housing department. So it's really seen as, it's the Department of Housing and Community Development, it is seen as DHCD's issues. We've heard it from other state agencies, I've heard it from different municipal and city leaders that say, oh, that's DHCD's issue to solve. When they can't solve it all. And when we talked earlier, there's people that have complex medical needs, there's people that have there's complex work situations, there's people that are not being paid. It's part of the Labor and Workforce, Department of Labor and Workforce Development, it's part of Department of Children and Families. It's everyone has a stake in this, as well as cities and towns. When you have a city and town that doesn't have enough affordable housing for the people that work in it, it's the city and town's issue. And so we really need to look at broader. I saw an interesting thing recently. There was a bank wrote an op-ed about how they read the number of families that don't have a safety net and don't have their own savings, and so they implemented something for their employees as sort of a no interest, no questions asked loan. And such a great thing. When you look at the number of people that are working low-wage jobs that can't afford to live in a community, that have to drive in, you have a car problem. What happens?
Right.
If you're living paycheck to paycheck, one emergency can lead you into homelessness. And how can where is the private market can go and can help make that safety net? Where can jobs, employers, municipalities, because it's not just the state's issue, it's not just DHCD's issues, it's everyone.
And in fact, that turnover and the churn in an employment force is very costly.
Right.
So there are some incentives there. So let me say one thing. Sometimes people will say, okay, if there's one thing you could do, what would be that one thing?
My response to that always is I wouldn't do just one thing. I think that's often the trap that we get into, is finding a solution is that this is the one answer, this is the silver bullet. It's not. Those situations are complex, families are complex, there's a range of skills and backgrounds, there's a range of jobs that people take, there's a range of supports that people need, and a range of things that work and things that don't work. So what we saw during the recession is we got a lot of money, and lots of different states piloted what they call rapid rehousing. So it's a lot of sort of one-time money to help people on their feet, which is wonderful for people that have short-term economic barriers, a job loss, a sudden medical emergency, and then that was resolved. But when you're looking at someone that's making less than $38,000 a year and needs to get it to $33 an hour, a one-time payment's not going to meet that gap and help someone jump from there. I mean, we have a low-wage workforce that's the workforce. That's what we need, those jobs. It's the people that are working in customer service. It's the people that are working in hospitals and all of those that we need supports for them. Mm-hmm. So I think you can't, but that doesn't mean that the short-term help is bad and wrong. And so I think we need to really look at how do you be able to meet the diverse set of needs, to not just look at the housing, but to look at the wage side, to look at the childcare side, and to have a variety of responses.
And I think in the greater Boston area, another piece of this is trying at all, in every way possible, to retain housing and preserve a tenancy. I remember when I was working in a nonprofit organization on behalf of homeless families, this frustration that I would feel was like, oh, we can't give prevention dollars to everyone because we might give it to someone who, might not actually need it. My take always was, you know what, if you give someone an extra $1,200 and that keeps their kid from ever experiencing homelessness, that's okay with me. That's really okay with me. So I think that's the other part in these really, really high cost communities, is being reality based about how it's very hard to recreate a tenancy. The low cost housing doesn't exist. And so the competition for affordable units is fierce. And if you have an eviction on your record, you're not going to be a great prospect. And so anything we can do to pay off arrearages, to keep that household, there's a little bit of my soapbox. Hello. So anyway, this is Meet the Problem Solvers. We're now wrapping up our conversation because there's a lot to be said about family homelessness. And I think what we really want to talk about is it's a very complicated situation. At one level, it's very complicated because of the intersection of all of these factors of housing costs, childcare availability, wages that don't keep pace with housing cost rising. But so it it is the intersection in terms of the solution, but the problem itself is really a pretty simple dollars and cents issue. And if we want to keep nibbling around the edges or doing a one-time intervention, we're pretty much going to be where we are. Is that a fair,
We've been
depressing
It's a depressing
conclusion?
stat. We've been growing it pretty steadily since 1983 when the system was established, and we've had some areas where it's gone down, but we've been on pretty much an upward trajectory, and it doesn't have to be that way.
Yeah. So tell us, Libby, what should we think about? We, as people who are learning about this, who are just hearing, how can we have an impact?
One thing, we're an advocacy group, so we always promote advocating, and it doesn't mean that you have to call with the answers. It's you're calling with the concerns. I think we're lucky in Cambridge to have some strong leaders. The Representative Connolly, Representative Decker, Senator Boncory all have some great bills, have all been really strong advocates. I would check in with them, check in with your state reps and senators, let them know that you're concerned, let them know that you want some solutions, explore the bills and some of the agendas that they have. Another thing I think is we have to support affordable housing. So when there's a hearing, and this is a very active community, but it's generally when you have community meetings about affordable housing, it's the people that say no, get there first. We need to advocate for housing and make sure that when the development is happening, it's happening to keep people in their community, and we're developing it for the people that work here, that live here, and not pushing people out. I think we need to really focus on making sure that we're not pushing people out and letting people stay in their community. So those are some key things.
Some action steps.
Some action steps,
Yeah.
and the big and little things that you can do in your own different ways, whether you're an employer, looking at how do we value things like lived experience, language capacity, as much as we value education, and looking at how do we get pay a living wage, support one another. There's lots of important bills happening around access to diapers, access to food, access to shelter, and just things that you can do as a community to support each other.